Hi, everyone. Welcome back. Thank you for joining me. Today, I'd like to take a little bit of time to focus on a specific part of a intervention that's used typically that is used when we are helping someone that might be having reoccurring thoughts or ruminations, which can often lend itself to anxiety, or when someone is experiencing anxiety, they can encounter ruminating thoughts, which can then lead to other behaviors which can impact the person. So, I just want to spend a few minutes today to talk a little bit about within cognitive behavioral therapy the technique of thought stopping. And thought stopping is a specific intervention, it's a cognitive intervention technique that's used by psychotherapists, psychoanalysts, those that are trained and certified in cognitive behavioral therapies, social workers, psychiatrists as well too that meet with consumers and patients on a one-on-one basis. And it is been demonstrated to be very effective for individuals that might have problematic reoccurring thoughts. So the goal of cognitive behavioral therapies, and I'll have in future videos, I'll have a specific module on cognitive behavioral therapies, but I wanted to start with thought stopping because it is connected to anxiety and feelings of anxiety. And since we covered anxiety last time, I want to spend some time to talk about specifically thought stopping. So, the technique is really has the goal of helping an individual, our patient or consumer, interrupt, remove, and replace problematic reoccurring thoughts. And it's considered a one of the core interventions and methods within cognitive behavioral therapies. And what's very helpful about teaching somebody thought stopping techniques, and what makes it a little bit distinct than other forms of psychotherapy or psychoanalysis, is that it involves the person consciously focusing on the thoughts and then employing thought stopping techniques to help to eliminate or reduce some of those problematic reoccurring thoughts. And so, one of the questions that you might have is, why would this even be important to somebody if they're experiencing anxiety? Um, how do cognitions or thoughts impact them? Well, when someone has a reoccurring problematic thought or thinking pattern, that, as we discussed last time, can create this cycle, this wheel of anxiety. That once this anxiety starts, people feel anxious, they have anxious thoughts, they have anxious behaviors, and the anxiety sort of builds like a snowball to the point where it impacts their daily life. So, if we can focus on one aspect of something that's creating for them, the consumer or the patient, this cycle of anxiety, and in this case, talking about problematic reoccurring thoughts, if we can help them to focus on that and to help eliminate or mitigate some of that, then we've done a lot in terms of helping the person overall managing their anxiety and stress. And I just want to be clear, this technique isn't just used by itself. It's used in combination with other techniques within cognitive behavioral therapy. It's often very helpful to supplement this technique, the thought stopping technique, with other cognitive behavioral therapeutic techniques, which we will talk about. Um, it's also can be helpful for somebody, for example, to have a log or a journal that they keep in conjunction with utilizing this intervention and technique. So, um, And as most techniques or interventions, they don't often work singularly on their own. They typically we employ different aspects and modalities, and we supplement these techniques so that we can help the individual, help them learn these techniques, but also provide a wraparound support for them. For example, uh, this technique alone wouldn't be effective unless the individual was also able to express to someone else that they were having these reoccurring thoughts, problematic thoughts. So um, just keep in mind that some of these things that we'll cover work best when they're in conjunction with other modalities and other therapeutic approaches. So let's talk about thought stopping and what it is. We talked about that it's a problematic, reoccurring thought. Let's give you 4 steps for how to help reduce these problematic, reoccurrent thoughts that can occur. And I'll go through these steps with you. And this is something that, again, if you're trained or certified, is something that you can utilize with your consumers and with your patients. I always recommend, and I think this is a bit of a disclosure, that anytime we go through a technique or an intervention, just remember that it's important that you have one, the capacity to utilize this approach and intervention, and that will require that you have good clinical consultation. So that's very important. So sometimes there is this uh, phenomenon in which we learn something and we want to try to utilize that technique or intervention that we've used. Well, in this case, in most of these therapeutic approaches, it's very helpful, and I would recommend that you have someone that is clinically consulting with you while you're utilizing these techniques. And so, also, given guidelines wherever you're watching this, in whatever state or county or locality, it's important that you understand that someone that identifies themselves as a therapist often requires minimal education, training, and experience. So, self disclosure, these are just educational videos to help you. But these techniques are helpful. But remember that it's important that uh, you know, as you take these techniques, don't just go out and practice them. Make sure you have clinical supports and guidance, and make sure that you're trained and skilled and educated in these areas before you begin to employ these techniques. But I will say this, having said all that, this is certainly something that is very helpful for an individual themselves to utilize as well, too, for themselves, thought stopping. Um, so let's talk about the 4 steps for thought stopping. Number one, notice the thought. So cognitive behavioral therapies begin with thoughts that we have. And it's important to know that in cognitive behavioral therapies, the thoughts are what we are focusing on that then lead to changes in feelings and behaviors. So notice if it's a awful thought or a worse than worst case scenario thought, which is a form of within cognitive behavioral therapies is called catastrophizing or and we will discuss those as I said later. So notice what the thought is. Is it a good thought or a bad thought for yourself? 2, stop. You can say stop in your mind. You can say it out loud. Sometimes people utilize even external stimulus to help them to stop. Counting backwards from 10 is helpful because we are taking time to take our focus away from that thought that we are having to something else. So stop. You can say stop if it's a thought that you're having that to you may be anxiety provoking. You might even visualize a stop sign or a red light, whatever helps for you to cue yourself or your consumer or your client to stop. Then challenge the thought. Are you distorting reality? Is the thought I'm having based in a form of reality? If it isn't, why am I having these thoughts? And notice if there are any absolutes, exaggerations, overgeneralizations, negative messages that might be coming from the past that in working with your client, your patient, your consumer that they are having. And for yourself, challenge the thought. Is this something of the past that perhaps someone has said to me? Or is this something of the past that I'm overgeneralizing or exaggerating? Is it a negative message? Oftentimes we might feel we're not quote unquote good enough. Why do we have these thoughts? So challenge the thought after you've stopped it. And then, four, last step, reroute your mind. Move your mind over to an inspiring or distracting thought instead. Last time we talked about managing anxiety through breath. That is can be a helpful way to help you to reroute your cognitive processes, your thoughts, to help you reroute your mind to something that's more pleasant. You might look at a photo, you might hear music, you might say, things will be okay. This too shall pass. This is only a brief period of time. So, one, notice the thought. Notice if it's a thought that might be an overgeneralization, an exaggeration, catastrophizing, etc. Stop. Say stop or use something to help you to remember to stop. Three, challenge the thought. What kind of thought are you having? Is the thought based in reality, or is it a distortion of reality, or is it something else? And then four, reroute your mind. You can utilize some of the techniques that we went through the day before with mindfulness or breath. You can use a visual, a picture, or help yourself to focus on something that's more pleasant. So, by doing these things, what we do is we create a sense of, over time, we create a sense that the thoughts that we have, we can manage and control. And that these thoughts we can then understand don't have to be the basis for the way in which we feel or behave. And the more that we do this, particularly with our consumers, our patients, our clients, the more they are able to help regulate themselves in terms of these thoughts that they have. So I hope this was helpful for you. This was just a brief overview of thought stopping within cognitive behavioral therapy, but I wanted to discuss it because I think it is important that you understand that cognition's thoughts can impact people's behaviors and feelings, but that ultimately we can, in this transitory period, we can move towards wellness, move towards peace of mind, things that we are all wanting to achieve. So I hope that was helpful. Comment below if you can, those of you that are watching this, what other specific types of modalities or interventions you'd be interested in learning about so that I can produce more of these videos. I hope you have an excellent day. Take care of yourself.